Today I will be explaining on Coenurosis. So my presentation topic will be Coenurosis. So for my content, I will be having my introduction, and then I'll be explaining on the epidemiology and the life cycle, and then I will be explaining on the clinical manifestations, the lab findings and diagnosis, the treatments and the preventions. So to introduce my topic, what is Coenurosis? So Coenurosis is basically a parasitic infection, which develops when they consume the eggs of the dog tapeworm species. Dog tapeworm species, which is Taenia multiceps, Taenia cerealis, Taenia brownie, or Taenia glomerata. So basically, it's a parasitic infection which occurs when people consume the eggs of the tapeworm species. So the Coenurosis is a fluid-filled cyst which has a diameter ranging from 3 millimeters to 2 centimeters or more. So it has a thin wall and a delicate membrane which is connected to rows or clusters, and also connected to several invaginated scolices, also known as protoscolices. So it is most common in tropical and subtropical areas. And also another factor to consider is that intestinal human tapeworm infection and human Coenurosis, they are basically two different conditions. And the epidemiology, so even though there is a high exposures through possible exposure is frequent due to the high prevalence in dogs and other candidates, fewer than 100 human cases of Coenurosis have been documented. So although the disease has also been documented in North America, France and the United Kingdom, majority of Coenurosis cases, they occur in Africa. So while the majority of cases they are reported from South Africa and other temperate regions, which includes the United States, involve subcutaneous sites. Majority of cases from tropical Africa, they involve intracranial localization. So at least there are 6 human autocapnosis infection cases that were reported in North America, and 3 of these cases they involve the central nervous system, and other remaining cases were localized intramuscularly or subcutaneously. So the life cycle of the so here we have I have an image that will explain the life cycle of the Coenurosis. So we'll go by the image. So firstly, so in number 1, when you can see, you can look at the eggs or the gravid protocols. So basically the infected definite host, they will excrete the eggs. They will excrete the eggs and the gravid and the proglottids into the environment, and then once they release, they become infectious immediately, and this could be and they are consumed by an intermediate host. So these are the hosts, they can be consumed by that. So when the eggs, they hatch in the intermediate host intestines, then there's a thing called the oncospheres. They are then released, and these oncospheres, they travel into the bloodstream until they land into an appropriate organ. So these appropriate organs include the brain, the eyes, the skeletal muscles, and the subcutaneous tissues. So these oncospheres, they will transform into cinuria, which is basically they are home to many protoscolices. So this transformation occurs like in 3 months. So by consuming the tissue with an infected, so if an individual, they consume this infected intermediate host, which has the Coenurosis image, this definite host, it gets infected. So in the definite candidate host image, the protoscolices mature into adult cestodes, and after they adhere to the small intestine walls. So when eggs on fomites or in food and water tainted by the feces of the infected defective host image are suddenly accidentally consumed by humans, infection results. So after the eggs hatches in the intestines, the oncospheres are released into the bloodstreams, where they settle in the appropriate organ, and after 3 months they transform into a cinuria image. So basically this is summing up all the things that I've mentioned up here. So yeah, so basically what happens is that the infected or the infected host, it will excrete the eggs and the proglates into the environment, and then it gets consumed by the intermediate host. And then once it gets consumed, the eggs, they will hatch in the intermediate host, and then oncospheres, they are released, and then it travels through the bloodstream, and then it lands in an organ. And once it lands in an organ, it becomes comfortable in that organ, it will then transform into cynorrhea. And then, like, basically in 3 months the transformation occurs. So after that, so if an individual, if a person comes and then it consumes the tissue of this infected intermediate host, they can become infected. Yeah? So in the definite can host, so the protoscolosis, they will mature into adult cestodes after they adhere to the small intestine walls. And then once they release out the feces, the cycle continues again. So the clinical manifestations. So when a person, they accidentally consume the eggs or the proglotids from the feces of the infected animal, which is basically typically a dog, so they can develop human cynosis. So a cystic lesion that may enlarge is often the result of human disease affecting the central nervous system. Yeah? Intracerebral cysts can be mistaken for neurocystorosis and echinocoenurosis, and can result in seizures. So individuals with this, they can face seizures and other signs and symptoms. And there were reports of spinal cord intraparenchymal lesions, and which can be linked to ocular involvement. Meningitis can lead to meningitis, iritis, aconitis, and epidermitis. So yeah, it can also lead to allergic symptoms like fever, night sweats, etc. So some of the lab findings. So lab findings to determine the presence of cynosis. So we have the results of imaging tests such as MRI, CT, or ultrasound. So these are used to make a diagnosis of cynosis. So in addition to reduced glucose and increased protein concentration, the CSF frequently has elevated pressure and may exhibit lymphocytic pleocytosis, and also histopathological identification of the parasites and surgical excisions. They are necessary for conclusive diagnosis. So a diagnosis may also be obtained by aspirating a cyst with a fine needle. So based on the quantity and features of their protoscolosis, cynosis larvae can be easily differentiated morphologically from cystariaceae and hydatid cyst. So cynorrhea cyst, it can be differentiated from echinococal cyst when protoscolices are absent or not visible due to the absence of the latter's distinctive cell wall. So the several species of tynid cystones such as T. multiceps and T. cerealis have been experimentally distinguished using PCR-based restriction fragment like polymorphism. So since there is no accurate serological test for cynosis, so this method, it can be helpful for both diagnostic and epidemiological purposes. So for the treatment, so the main treatment of cynosis is surgery. So excision is recommended in the majority of central nervous system symptomatic cases, and it may be effective for patients with single intraventricular or small intraparenchymal cysts. So control trials have not assessed the use of medications like praziquantel and albendazole, which are effective against other level cestodes to treat cynosis. So prevention. So when the local cestodes in humans and domestic ungulates causes cynosis in humans, so the disease, it can be controlled by strict regulation of animal slaughter, periodic treatments of dogs, and health education. So when the cystode occurs in wild animal hosts, preventative measures, they are limited to careful avoidance of potentially infected carnivores and adequate hygiene. So this is my reference, and